Hello, good morning to everyone. Thank you for this opportunity that you have given me. I'm Langwa Elizabeth Fikala, the director of St. Elizabeth National Residential Home, Senhofa, Cameroon. I have master's degree in mental health and psychiatry. I have master's degree in clinical counseling and psychology from the John Hopkins University online. I have master's degree in humanitarian crisis. I also have bachelor's degree in geriatric nursing and HND higher national diploma in general nursing. I have 15 years in the medical field as a nurse, and I have 5 years experience as a mental health specialist and geriatric nurse. I did my research in Cameroon, in the Northwest region, and in Oguja Cross River State in Nigeria, where I run my organization for mental health and elderly persons. From 2016 to 2023, I found out that mental health persons and elderly persons suffer abuses. The objectives of the organization was to strive, uphold, restore the right and dignity, and to guarantee the general well-being of the vulnerable elderly person and mentally deranged. My result, many mentally deranged and elderly persons face a lot of problems, which include abuse and corruption, inadequate mental health care and elderly health care facility, only few and highly cost facility available which many cannot afford, and as such most of them run mad on the street. Vulnerable persons have no access to health care due to their poor situation. They face poor health and poor nutritional status. Too few housing facility. Most of the elderly IDPs and refugees has no place to stay. The elderly IDPs living in town you meet some of them living about 13 to 15 persons in a room, and most of the elderly refugees living in the refugee camps, some of them have no houses and live under tents or shelters. Some of the elderly refugees face a lot of exploitation in shop. Too few community-based services and empowerment programs to sustain them. Lack of social security system, HIV and AIDS pandemic, neglect, marginalization, disrespect, exploitation, violence, and abandonment. In disadvantaged areas like Babingo, Babisi, Jakiri, Kwanso, Babanki, Mankon, Minankwe, Baminda 1, 2, and 3. In other areas of Bafusam, Yaoundé, Douala, Buya, and other states, and in Nigeria, where I carry out my research, the study says that many elderly persons with their orphans and mentally deranged children face a lot of abuses. What it means, surprisingly, in the interview, we are subject to delivery of food items, which more than 50% have never received support or been registered in any organization. Most of the elderly refugees in the refugees camp, they have nothing being offered to them. They stay without food for about a month, and the UNHCR only give them 2,000 naira a month, which is not oftenly given. Sometimes they can spend about 6 to 7 months or even 1 year without receiving anything or any support. which this elderly person has no strength or cannot afford to do any activities to sustain themselves, which have led to many deaths, including suicide from the elderly people because of the situation they face in the refugees camp. They face exploitation as shop, unsatisfied healthcare services, and no access to healthcare due to their poor situation and high cost of healthcare services, especially in mental health clinic, despite their heart situation. Personal safety. Many of the vulnerable population face insecurity and are not safe due to ongoing socio-political crisis in the northwest region and south regions of Cameroon. Loss of respect of elderly, having to care for grandchildren of their large children with no means of survivors, especially when with their poor health and nutritional issues. Diverse infrastructural deficits. Most of the elderly IDPs, as I earlier mentioned, has no place to stay and have no place to stay with their grandchildren. More than 13 to 15 people live in a single room on accumulated rent, with accumulated rent more than 7 months, 1 year. Some of them, the landlord have packed them out of their house, which they have no place to stay. They also have poor sanitation and poor roads. Abusive and discriminative. That the situation constitutes systematic abuse that contribute to their marginalization, exclusion, and therefore violation of their rights. Size, severity of the issues, needs, and evidence. The total number which we conducted the interview was about 15,000 elderly, including those with mental issues. 75% were bound to physical and abuse, including rape. 25% of the elderly have orphans with their late children. 250 had children with disability and mental deranged, and most of them have nothing to live with, no source of income. 100 suffer from chronic illness like high blood, diabetics, HIV and AIDS pandemics, and mental issues. 250 face abandonment, rejection, neglect from families, including false accusation of witchcraft, banishment from the community. 55% are IDPs and refugees with no housing facilities and have never received support. In Bamenda, mentally deranged persons, about 75% don't receive treatment, and they are forced to go out on streets. They go out on street, becoming prone to all sorts of abuses, including rape and physical assault. 85% of mental cases include youths who are indulged into drug addict due to unemployment, school dropouts, and financial issues. Our organization is established to address issues of elderly and vulnerable persons abuse. We provide empowerment programs to elevate poverty among the elderly and vulnerable population and to prevent abuse. Type of abuse that are reported to occur in the community and the social environment can be classified as physical abuse, which include beating, shouting, emotional, verbal abuse, discrimination and harmful words, accusation of witchcraft, banishment, ostracism, physical danger, seizures of assets. financial abuse, which include extortion and control of assets and money, sexual abuse in sexual rape and criminal rape, neglect and lack of respect, withhold of affection and abandonment, systemic abuse and dehumanizing treatment, including health clinics, pension pay points, and government offices. To conclude, issue of elderly person and mentally deranged need to be addressed worldwide, especially in Africa. I urge on all on any other organizations that wish to partner with us in order to create more facilities, more mental health facilities and facilities for elderly care. In Cameroon, we have just about 10 to 15 mental health facility, and under our organization offer a long-term care and long-term care for the mental health and the elderly. I wish to appeal to the public health, UN, WHO, UN stakeholders to look on the health situation of the mentally deranged person and older person, to grant them access to health care, full mental health treatment, and to also help them enroll into the universal healthcare services. Considering the rights of the elderly person, which the International Human Rights and African Chapter said concerning the elderly person, state that every older person have the right to access the health care at the highest standards of their choice, no matter their condition and background. So mentally deranged and elderly persons have been neglected and marginalized and abandoned. I urge that their rights should be respected in every aspect, including healthcare, economical, social security, and basic needs, housing, and food distribution. I also ensure that the orphans of these elderly persons are being granted access to education. Thanks for listening.